siya, unya, minungguhan nga bulad pod pagkagabi. So, kinsa may dili mo taas ang protein, no? Na high salt diet man. So, this would really, ang ating kidneys would really release, no? Big globules of protein. So, makikita na kaagad yan sa ihi niyan. Okay? So, this would really indicate the patient is high risk for hypertension. Alright? Then, meron din tayong tinatawag na danger signals such as vaginal bleeding. So, kailangan din natin sasabihan yung mother, what are those danger signals such as vaginal bleeding? Manong gidugo man ka, katunga-tunga sa imuhang pagbuntis. So, there is something wrong, no? It's either overwork si mother, or the main cause of mga premature labor, premature delivery, and of course vaginal bleeding is sex. Nung na ay partner si mother and then nag-sex sila, kaya di na jud maantos. So nag-sex. So this can cause premature contraction which can lead to vaginal bleeding. Or maybe, yung mga danger signs like, mura man kong nangihi, ma'am, di niya makontrol na ay nagagawas ng murag tubig sa iyang puwerta. So, ibig sabihin yan, hala, nag-rupture ang amniotic fluid ni baby. So, this would indicate later on, pag na marami nang lumabas, this can trigger premature contraction of the uterus. So, we don't want that to happen. So, these danger signals, no, during pregnancy should be taught, no, sa pregnant mother natin. Alright? Then, what are the signs of impending labor? Okay. So, naglakaw-lakaw sa mall karon, hay, ni-contract ang tiyan. So, nihunong siya. So, the only thing that can stop this premature contraction, guys, no, is to raise your leg. No, i-raise natin ang leg natin for the muscles there to relax. Inhale, exhale, then rest the leg. So much so, yung fluid doon sa paa would go to the middle, no? This can help, guys, na to stop yung mga premature contraction ng uterus ni mother. Alright? So, all of this, no, ituturo natin yan for you to have a good, what you call this one, no? Yan, good nurse-patient interaction. Marami kayong ma-share sa inyong mother. Okay? So, ang psychosocial assessment naman should focus on any specific concerns of the woman or her partner. Like, for example, sexual activity, preparation for parenting, childbirth, and signs of labor. So, as you can see here, part na talaga siya sexual activity. Alright? So, yan. So, depende na yan as what I have mentioned for in our previous meetings, no? Ang sexual activity ng couples, no, would really need permission from the obstetrician. O, lalo na pag ang mother is a high-risk pregnancy. Alright? Then, nutritional assessments such as a review of dietary intake of iron. So, iron can be you can get iron from the foods that you eat, no? Dapat iron-rich foods po ang ginatake ni mother. So much so she can get enough iron. But sometimes, no, this cannot be achieved, no, through the diet. So the doctors would check on the CBC to check the hemoglobin count of the mother. And then if it is very low, that is the time wherein the doctor would really prescribe some iron supplements. Okay, then 24-hour diet we call, no? Ano ba ang kinain ni mother? Umaga, breakfast, lunch, and then dinner. And then what could have caused the weight gain? No? If the diet naman ng mother, okay naman, what could have caused the weight gain? Okay, so yun. Is it the diet or the what you call yung retention of fluid due to hypertension? So, yun. So, kailangan talaga natin malaman yun, guys. Okay? So, we go now to birth plan. This is what I'm talking about. Ang pagbubuntis ng babae, may plan talaga yan. Hindi pwede yung urada-urada or accidental. Okay? So if you have undergone already your menstrual cycle, so be careful, no? Because we cannot say that lahat naman ng tao hindi nag-engage into the sexual activity. But you know for the fact na ang mga babae, mabubuntis talaga yan, lalo na pag na-timingan na ovulation ka. No? So you should know your cycle and then your secretions for you to be protected against unplanned pregnancy. All right? So what is birth plan? This can help prepare the woman and her partner establish realistic goals which relate to the concern for the safety of the mother and the infant. Okay? Sandali lang guys ha. Meron ako tingnan. Okay. Madilim na dito sa lugar ko. Okay. Anong oras na ba? It's already 5. Okay. Okay. So a birth plan usually includes information regarding the couple's preferences for labor, birth, and the immediate care of the newborn. Who would attend to the pregnant mother during labor, during birth, and who is their pediatrician that would attend to the newborn. No? They have the preference. Okay? So ikaw magpili sino ang OB mo, sino ang pedya mo. Okay? This is what this means, no? If you are really prepared, no? Plans also are included for complications that may arise. Okay, if you have already birth plan and you know for the fact that your partner is hypertensive, so you as a couple is prepared for any complications that would arise during delivery. All right? So alam ng partner. So the ultimate goal of any birth plan is a healthy infant born to healthy parents. Alright? Yan. So what is childbirth education? This assists couples in making important choices, which will go into their written birth plan. The most important choices include selecting a primary birth attendant. It can be obstetrician, pediatrician, or midwife. Determining where they prefer the birth to occur. Is it sa hospital, sa lying-in, or sa bahay? So, home birthing is not really recommended for first-time mothers. Alright? So, dinidiscourage na rin po ang home birthing. Unless you will give birth to lying in. But when you plan to give birth sa lying in, they have also their rules. If it is your first time to give birth, you are advised to go to the hospital. Kaya sa mga lying in, G2 na. So, second pregnancy na po ang pwedeng manganak sa mga lying-ins. Alright? Ang hospital talaga, first or succeeding pregnancies, pwede sila magtanggap niyan. Kasi hospital man. Okay? Pero sa lying-in kasi limited lang po ang kanilang supplies. And hindi masyado sila, anong tawag mo dyan? Wala sila mga emergency, no, mga equipments. Unlike when you are in the hospital, meron tayong tinatawag na e-cart. Okay? Lahat nandun na yung mga emergency medications, emergency gadgets, emergency instruments that can really help you, no? Na kung nahihirapan sa panganganak. Alright? Then selecting a preferred birthing approach for managing labor. Like for example, Lamaze method or Bradley method. So Lamaze is the most common method of a birthing approach. No, your husband is with you during your delivery. Okay? Kasi you are with your husband during in preparation. You are with your husband during the Lamaze sessions. No? So your husband knows how to handle you during delivery. Okay? But, of course, kutob lang siya sa mga hapyod-hapyod, gunit-gunit sa imuha. And then coaching sa imuha. Dili siya pwede siya mismong paanak sa imo. No, it is not included. Doctors are the one who assist in giving birth. So deciding whether or not to use medications and what type, narcotic ba or anesthesia. Alright, if you are in pain already, do you opt for an anesthesia or a sedative in that manner? Okay, so you have a choice. All right? Then deciding what medical interventions are acceptable or not during labor and delivery. So the doctor would say, hindi mo talaga kaya ilabas ang baby mo. So gagamit ako ng instruments. So ang instruments, delivery via instruments, dalawa lang po yan. It is through vacuum extraction or through forceps delivery. All right? And sometimes the doctor would perform episiotomy. So what is episiotomy? This is the surgical incision of the perineum to facilitate the delivery of the head ng baby. Kasi sa sobrang laki ng head ni baby, di siya magkasya lang sa vaginal introitus. So the doctor would cut the perineum, all right, to facilitate that delivery of the head. Once the head of the baby is out, the rest of the body follows. All right? So yan. Then, you get to decide what type of activities to implement during labor and birth. Like, you wanted to have music. So, during labor, you wanted to walk, no? But there are certain situations wherein you are not allowed to walk. Lalo na pag ruptured na po yung bag of water ng mother. Yung nakabalot sa baby na amniotic fluid, amniotic sac, pag na-rupture na yon, baby na yung lalabas niyan. Hindi na wala ng water. So that is very dangerous. Okay? If you wanted to use a video or photo to document your birth, we can ask permission from the hospital. Kasi meron tayong hospital protocol to follow when you want to have photos or videos during delivery. Alright? Then deciding the direction of postpartum events such as immediate contact with the newborn. Right after delivery, you wanted your baby to be beside you. Alright? There are cases if the mother is sedated, the baby is directly brought to the nursery. Kasi nga, paano pa siya maglangga-langga sa baby niya na she is asleep. Okay? Then, a chance to breastfeed immediately after birth. Yan yung ating ipapakita namin sa inyo if you had your DR or if you have extra time, no? Yung ating tinatawag na unang yakap, no? The baby is held sa chest ng mother, no? For the first 60 to 90 minutes after delivery, the baby is placed on the chest of the mother. Okay? Para yung heat ni mama warming the baby, no? Yun. Then, rooming in of mother and baby. If the mother is wheeled out ba sa delivery room, she get to have her baby already roomed in together with her. No? May mga ganyan tayo ng mga situation. Then, use of pacifiers and supplemental feedings for the newborn. Alright? If the mother is unable to breastfeed, so pwede bang magbigay ng supplemental feedings? So that the hospital now is not allowing any supplemental feedings, only breast milk po. Okay? Pacifiers also is not allowed. Delaying of newborn eye treatment. So tayo as nurses in the nursery, automatic po tayo, maglalagay po tayo ng mga antibacterial ointment sa mata ni baby. Kasi alam naman natin kung saan gumaan si baby. So there is what we call undiagnosed cases. Hindi natin alam, ay, may UTI pala si mother. Tapos dumaan siya sa puwerta ng mother. So the baby can have Escherichia coli infection sa eye niya. Kung yun ang causative factor ng kanyang UTI. So, automatic talaga yan na maglalagay tayo ng ophthalmic ointment. Then, of course, if the mother would want to have an early discharge, of course, before we discharge a particular client, lalo na sa hospital, meron tayong assessment na ginagawa sa kanya. Alright? Before she will be allowed to go home. Definitely, dapat contracted yung uterus niya para hindi siya magdugo. Kasi pag hindi siya contracted, definitely, magkakaroon niya ng bleeding ang mother, which is very dangerous sa mga postpartum mother. Alright? Yan. Then, okay, how about assessment? So, first, we determine the woman or couple's expectations about instruction, and about childbirth. Okay? We identify cultural expectations and influences on the mother's behavior during pregnancy, labor, and birth. Cultural expectations, so there are cases, mga good guys, na doon tayo sa delivery room, kung hospital-based, very sterile po ang area, lalo na sa San Pedro Hospital. We really apply sterile technique. Okay? Once the patient has certain habak-habak, naamang guna sila gina some of our client because of their belief ba naay na sila mga habak gina naasa kung dili man sa ilang tiyan kay di naman sa maigo na kaysa kadako sa iyang tiyan, so dili nila ipulipot sa ilahang legs. So ang ginagawa is remove it, no? The patient should remove it if the patient would want it near her, so be it. Ilalagay natin yun sa cellophane and then ilalagay natin sa tabi niya. Alright? So, in that way, we still maintain the sterility of the environment. Alright? Then assess the couple's readiness for decision making. No? Whatever happens inside the DR is where you cannot say kung ano ang mangyayari talaga sa DR. Hindi lang kay normal delivery po. May iba pong nangyayari yan. Normal yung patient natin, biglang nagka-complicate yung kanyang delivery. So, nagkaroon tayo ng bleeding, umaga, postpartum bleeding, anything can happen. Alright? Kaya hindi nga natin ma-predict manganganak na ba ang pasyente o hindi. We cannot predict it. There are times na andyan na talaga yung ulo, but due to the factor, bakit kaya hindi nakalabas yung baby na nandyan naman yung ulo? Crowning na, kumbaga. Nakikita na yung ulo ng baby. Yung pala, very short yung umbilical cord ni baby. And the baby is subjected for cesarean delivery. Alright? May mga ganyan na mga, kumbaga, situations, guys. Lalo na pag ang patient has no ultrasound result, ay nako, mas lalong mahirap po yan. Kasi hindi natin talaga alam, hindi natin talaga walang result ng ultrasound what is going on doon sa uterus ni baby. Uterus ni baby, uterus ni mama. Okay? Assess their learning needs as a couple and as individuals. Evaluate the client's knowledge of physical and physiological changes, no? Ng pregnancy, fetal development. Alam ba nila kung paano nag-grow si baby inside and what could have happened if the mother is exposed to teratogens, mga ganyan. What to expect during prenatal visits, yung pagpapacheck up niya every now and then. Then of course, the preparation also for labor and delivery. Yung knowledge ng couple is very important. Na? If they are really prepared, no, of whatever would happen inside DR or during delivery. And how about newborn care? Of course, kailangan nila malaman na dadaan pa po yan sa nursery ang baby nila. And then, bibigyan po yan siya ng mga gamot. Like for example, vitamin K to prevent the baby from bleeding. And of course, self-care. How to go about self-care postpartum. Alangan naman di nato na dili mag-hygiene ang mother after delivery, manimaho na siyang ambot, no? Di na ka expect. So we would really tell or educate the mother on how to go about postpartum hygiene. Then what could be the possible diagnosis? So anxiety is number one. Why? Anxious ang mother. Unsa kayo may tabo sa ako kung mga anak ko. Okay? Kaya ba nako? Ana. Then also fear also of what will happen or what to expect inside DR. So we make it a point when we are a DR nurse, okay? We make it a point to make the patient comfortable and at ease. Alright? Kasi pag siya kabado, it can affect the way ang iyang performance during delivery. Okay? Kung kulang po siyang kaalaman, knowledge deficit, walang alam, magsabi, sige na lang na sila ingon, tabangi ko ma'am. So all we can do is to coach her how to go about delivery. Alright? Then ineffective management of therapeutic regimen can also happen. Like for example, non-compliance. Wa nag-comply si mother sa mga therapeutic regimen na giingon sa iya. See what happens. No? Then powerlessness. The mother has no power when inside DR. Okay? Kasi wala siyang magawa. The only thing that she could do is deliver the baby. No? The only relief the mother would attain would to deliver the baby. Wa nagyulain. Then of course, decisional conflict would come last. It's because this could happen between the couple. No? Meron silang mga conflict with regards to the delivery. Lalo na pag ang mother naka-recover na, ando na siya sa room, then nasyakira sila sa bill. O, yan na. They were not expecting because something had happened. So a lot of emergency intervention is applied to the mother. So, yung mga ganyan, no? Planning and outcome identification. So the couple's anxiety and fear related to pregnancy and childbirth will be reduced. Okay? As much as possible, i-reduce talaga natin yung mga anxiety at saka ang kilang kahadlok. Okay, the couples plans to attend childbirth education classes and other prenatal and postpartum education programs as appropriate. As much as we would want to give them health teachings, dapat kasi ina-encourage talaga natin na couple sila mag-attend ng mga childbirth education classes. We would really emphasize it to them. Okay, particularly during prenatal checkup. Okay, then of course postpartum education. There is a lot to consider during postpartum period. Aside from the risk of the mother in acquiring hemorrhages after delivery, the mother can have psychosocial changes during after delivery. So dapat alam yan ng significant others. Di ka pwede na panganak na siya, di na mo siya pansinon. So psychological would put a toll on the mother. Yeah, you would come to know that one when we discuss the postpartum. All right, the couple will keep all prenatal appointments. Okay, so kung like for example, no, prenatal appointments, pupunta talaga siya kung oras ng check-up niya. And then kasama talaga ang significant others. Hindi po talaga pwede na hindi kasama si husband. Kung si husband wala dito, husband is an OFW, then member of the family should come along with the mom. So much so, ang knowledge nila is both of them knew what would happen during pregnancy, during childbirth, and how to integrate the baby to their family. Okay, the couple will plan for pregnancy, childbirth, and newborn care by making informed decisions. So the decision to get pregnant and what to encounter during the delivery process is the decision of both